Typhoid fever is found worldwide. There is an estimated 21 million new cases of typhoid fever every year, resulting in roughly 200,000 deaths annually. The disease burden is particularly high in developing nations where urban districts are overcrowded and sanitary conditions are poor. In fact, approximately 80% of cases occur within the countries of Bangladesh, China, India, Indonesia, Laos, Nepal, Pakistan, and Vietnam. Humans are the only reservoir for Salmonella typhi. Human-to-human transmission occurs via exposure to those with acute illness and to those who are asymptomatic chronic carriers. Chronic carriers of S. typhi are those who have positive stool cultures greater than 12 months after acute disease. Risk factors for becoming chronic carriers include female gender, history of cholelithiasis, history of biliary tract abnormalities, history of urinary tract abnormalities such as nephrolithiasis and benign prostatic hyperplasia, as well as concurrent schistosomiasis infection. Both those with acute and chronic disease shed bacteria in their stool and urine. Transmission occurs if these bacteria are ingested in contaminated food, particularly shellfish, and water. The most famous carrier of S. typhi is Mary Mallon, also known as Typhoid Mary. Mary was the first healthy chronic carrier ever identified. She was born in Ireland in 1869 and immigrated to the United States in 1884. She worked in New York as a cook, and as she changed places of employment from one household to another, at least 53 people became infected with typhoid, resulting in 3 deaths. After much investigation, these outbreaks were traced back to Mary. Though it was known that transmission was inadvertent, given that Mary refused to change occupations or to provide stool and urine samples for analysis, she was quarantined for 3 years. While quarantined, she admitted under questioning that she rarely washed her hands, and cultures forcibly obtained were positive for S. typhi. She refused to have her gallbladder removed and was eventually released after she agreed to change occupations and to take hygienic precautions. Soon after her release, Mary changed her name and returned to work as a cook, only to incite further outbreaks of the disease. This next series of cases resulted in a second quarantine lasting 26 years, until Mary's death from pneumonia in 1938.